Weiss. I'm a member of the Canine Collaborative. We're a small nonprofit organization looking to build an indoor dog training, educational service training place in central Vermont, Washington County primarily. Probably wouldn't work real well in Cabot or Warren, so we're looking a little bit closer to Montpelier. This is our first presentation that we're having, and we're very fortunate to have Dr. Bradley from Onion River Animal Hospital to present our dog first aid. We also are fortunate to have many members here from the Central Vermont DART program, which is the Disaster Assistance Response Team, right? Okay. And Kate will be able to give you some more information. Thanks.
Hello. First of all, we do have a very confusing name. We are the DART, Vermont Disaster Animal Response Team. And what we do is we respond to community emergencies where people potentially have to shelter their pets somewhere outside of their home. So like the last couple of floods, the last few years, we've opened up shelters. We will take in people's pets. Usually it's cats and dogs, but also we've had rabbits and we've had guinea pigs and things like that. And we will shelter them until the people, usually until people are able to go home. We work in conjunction with the Red Cross. We're usually set up next to a Red Cross shelter so that the people can be on one place and they can come and talk to their animals and that sort of thing. We are a very active chapter. We're all volunteer. We have monthly meetings, and we do things. In the last few months, we've had talks on guinea pigs. We've had somebody brought in some dogs, and we talked about how to bring dogs in and out of crates, that sort of thing. So we talk about how to sign people up when they're coming into the shelter. We're very hands-on. It's a lot of fun, and we're always looking for volunteers. So there's the plug. And we have a table set up out there with information. This one it's a disaster supplies for cats, and we have another one, disaster supplies for dogs. And what they are is they tell you things that you should have on hand in case of a disaster, so that if you need, there's a fire coming, you have half an hour to get out, you've got your go bag ready, and you know what to put in it, and you know where to take your animals. And that's the sort of situation if it was a large-scale emergency. CVDART or VDART would have a shelter set up, and you could come bring your pet to the shelter and leave it with us. During the 2023 flood, we were open for just about a month. I think it was 28 days, and we sheltered 75 animals, something like that. So if anybody has any questions, we'll be hanging around afterwards. And as I said, we have a table, we have all sorts of information, and come talk to us.
Thank you. I have just a few housekeeping rules. Bathrooms back there on the left. My left, your right. And we need to be out of here by 8 o'clock. So we're going to sort of keep this to like 7:45. Dr. Bradley has welcoming questions throughout her presentation for clarification purposes. We're not going to talk about anything that is to do with training, obedience, anything else but first aid. We're really focusing on first aid with this. Other events that we might present, we'll go down that road when we get there. All right. So here's Dr. Bradley from Onion River Animal Hospital. She's the owner
Thank you. A lot of familiar faces, some I've seen very recently, even today. So welcome, thank you for coming. And fun facts about VDART. So I was actually in on the ground floor when those were starting. Anyone know why we started having to have animal response teams in every state in the country? Hurricane Katrina. Yes. So people will not leave their homes in a disaster if they have to leave their pet behind. And they found that out in a big, hard way in Hurricane Katrina. And after that, actually, thankfully, certain states started doing things, but and our American Veterinary Medical Association, our foundation especially, did a lot of animal disaster response. And then Congress actually enacted and said every state needs to have ability, and you have to have shelters where people can bring their pets in or provide for them. So And they're still very volunteer organizations, and every state has very limited funds for these. So support them all you can. It's ideally rare they get used, but when they're needed, they really are, and as we know from a couple years ago. So what I am asked to talk about is first aid, and I am usually pretty good at public speaking. I am dealing with this microphone, though, that I might have to turn off and set down and then just use my big girl voice at times. We have a lovely dog to demonstrate on. I didn't want to do a PowerPoint because any of us who grew up on PowerPoints are probably PowerPointed to death, and I'm hoping I'm more engaging than that. So when we talk about first aid, so the biggest thing is this is kind of like the disaster response, is you want to be prepared for some of the worst case scenarios. And some of the things I'll bring up are gross. I'm going to try to not show you anything that's a gross picture, or I'll give you a warning to cover your eyes. But it's like, well, what would I do in that situation? I think that's where a lot of people get fascination with true crime nowadays, is well, what would I do in that situation? And so thinking ahead to, well, what if, and I'm mostly focusing on dogs here today, because cats will kill you. But the reality is, most of what I'm going to talk about is the first thing to stop and think about is safety of the humans. We all need our fingers. Any hand surgeon will tell you all the worst things they've ever seen from an owner trying to do something for their beloved pet who would never bite anybody, trying to open their mouth, and then they lost a finger or they've permanent damage and they cannot play the piano and they're a concert pianist, like all those terrible things. So this website is my go-to for you. It's Vet Partner. It's a little out of focus there. If someone can pull that back for me, well, no, just the projector a little bit. I think we go, does that work? Am I wrong? IT focus, do you know how to focus? Just, yeah, I don't know how to do anything. IT. I can try. Aha.
There you go.
All right, there's a little bit. So now it's too small. But Vet Partner. So if you want to write down that website, if you Google Vet Partner, there's a veterinary information network. So you can get trusted resources. There's all sorts of information on the internet. We know it's not all good. So this is one you can trust because it is written not only by veterinarians, but often specialist veterinarians. Like Dr. Geller there has a lot of letters after his name, and so do some of the other authors. So they are certified in emergency and critical care. So they're not just your regular veterinarian like me. They've done a residency and specialized in emergency and critical care and things like that. They have articles on chemotherapy for certain cancers, any kind of medical condition. But what's great about this one too is, for today's topic, anything I'm going to talk about today, if you want more information because you're not here to take notes, what? Yeah, now we want to blow it up. There's the list. Here's a pretty good comprehensive list, and some of those, once you click on them, you can find even more. We sort of cherry-picked a few that are important. I want to go back to the safety. So the first thing is something happens. Your dog is traumatized, hit by a car, impaled by a stick, really bad cut, and there's blood everywhere. And if you're someone who can handle it and doesn't faint, the first thing I have to tell you is to try to stop and breathe. If you have anybody that can help you that's a family or friend, get them, because two brains will work better. Because if you can't stay calm and deal with it under pressure, then your dog is going to panic and you're not going to be able to help it out. And so when I go to safety, anything we offer that you can do has to be with a cooperative dog. Obviously, sometimes we're dealing with an unconscious dog and they're pretty cooperative, but when they're conscious, their first instinct can be to stop. I'm in pain. I'm worried what you're going to do is going to hurt. And so I don't want anyone to ever get injured in trying to help their dog. There are ways you can help that are not going to get you injured. So with the safety things, I brought a few props. We're going to see if this makes feedback. Magic touch. Some things you might have at home because we sent them home with you and they were impossible to use, as we discussed. The infamous cone of shame. This is an excellent tool. If you ever got one sent home, be environmental, keep it in your garage forever. It's plastic, it'll never die. But the reason being is this is a great thing that if you can get it slipped over your dog's head, it's a pretty low stress way to handle keeping their mouth away from hurting you. My technicians are amazing at a stressed dog. They need to maybe do something with a nail or get a little blood sample. They will put this, slide this on, and then they'll feed peanut butter, or they'll have peanut butter in here the dog can lick, and the dog doesn't really realize what's going on as much. But it's basically a cushion as they, and I can't fit it on Happy Husky here, but without opening it up, but they will hit the cone before you with their mouth if they're turning to stop you. So the cone of shame is a great tool. These are great things to have if anybody has them, or they have a dog that they work with and they just need a safety measure. The best, so this is if you have a dog you kind of need a safety tool. These are called Baskerville basket muzzles. They kind of look like something Hannibal Lecter wore, right? But what's great about them is the dog can pant. You can feed treats and peanut butter. There's good instructions and videos on how to fit them and how to buy the right size for your dog. They're a pretty soft rubber. They don't hurt, but I can pant, I can bark, I can growl, I can make noise. I can dip my head down and drink water if I need to. So they're a good way to protect everyone also. So a Baskerville basket muzzle. And then in that situation, though, of panic, right? We just got to do something for this dog. The bleeding is so bad, we've got to put some pressure on it, right? You're cut. What's the first thing to do? Your kid's cut. Direct pressure, right? We want to stop the bleeding. Common sense, basic things. That's all this is telling you to do with that. So back to that, say, really bad laceration on the dog. If they're going to try to stop you and bite, then, and you don't have a cloth muzzle, you can do some tricks like, I'm going to hold you here, Happy. I have a slip lead here, one of these little slip leashes, but basically using this to just show you how any way to tie the mouth shut, you're not hurting them. You're just trying to get their mouth secure. You can do like a loop around, and I'm in his mouth because I can't close it, and around, and you can kind of hold it like this. Pantyhose work great for tying around. Yes. Yes. So can someone be my assistant? Will you hold our dog up high? Thank you. So, when we're kind of being tricky, well, snug around like twice, and then you can hold behind. But a tube sock is a great thing too. A tube sock you can tie, and it's soft and squishy, but it's just gently closing that mouth so that if I turn, I could not bite. Let's pretend, are you okay to stay up there with me? Thank you. So if we pretend that we've got a really bad cut and it's just a lot of blood, most people panic, throw the dog in the car, and race to the vet clinic. And that is fine if you really want a big bill to clean your car out of blood. So try not to have your car coated in blood. If you could get something wrapped on there, a lot of us have an ACE bandage at home, right? ACE bandage is great to just, and you're not trying to get tourniquet level pressure. We really almost never want that. We just want a level of just get some wrapping. Back to that tube sock, that would work. We're doing this. We can grab a dish towel from the kitchen and a sanitary pad for a woman and put it on and just wrap that dish towel and tie it in a bow just to get a little bit of pressure. Maybe the dog is so comfortable and cooperative, they'll let you someone just wrap them in a blanket and then just hold their arm on there. But if you can get a little bit of pressure, they're not going to lose as much blood by the time you get to the vet. I always give people, in one of the lists that we'll have is like what to have in your first aid kit. A lot of times I think of like, you're going to go on the long trail for 2 days and camp overnight with your dog. What should you have with you? And these are things that I think one of the guys in some local places are willing to put together and show you some things you can have. This is our go-to bandage material. It's Coflex Vet Wrap, we call it. They have it for humans. They sell it in the human pharmacies too. It's also a great thing to have on hand whenever we're bandaging, because you got to hike out, then get to the vet, right? You've got a long way. You've got to do more than just the 15-minute drive or something like that. You're going to want to put something absorbent. I left one of my props out. Like non-stick pads, Telfa pads. You probably have them in our medicine cabinet that you would just slap on there. There may be dirt and debris. You don't need to spend a lot of time trying to clean that out because that hurts. That's not what we want. You can put antibiotic ointment. Again, I'll go over my list there. Like Neosporin or something on it, Vaseline, anything that's just going to keep it moist if you want. But pretty much that's not going to stick and get cotton fiber stuck down into that wound. And then you want something soft like a cotton roll. You could just put this vet wrap on. All right, we can put the dog down. that's my quick, be safe, quick bandage one. A lot of what you deal with are the cut or the laceration. Once they get to the vet, if it's deep enough, then we really want them to be, they're pain controlled, sedated, and then we can really flush out any dirt, debris, make sure that cut doesn't go so far, suture it if it needs it, or staple it, or sometimes we're just doing bandaging and setting you up and teaching you how to do those bandages at home. I'm going to start with the wounds and trauma here. A gross one that is really scary is an impalement. Where a dog may fall on, say, a broken fence post or a stick. Dogs are sometimes get a stick going out like through the back of their throat here because they were chewing and playing on it. It's most of the time best to just leave that in place and get them to the vet so they can get sedated so that when it's removed, if it is going through a major vessel, we're right there ready to clamp it and not let them bleed out. If it's a pretty common sense, like it's just through the side of their cheek and you know you could pull it out comfortably, that's okay. If it ever penetrates any part of the trunk, your chest or your abdomen, the best would be to maybe saw it short, 3 to 6 inches, and try to immobilize them, wrap them in a blanket, get them to the vet. I have had big dogs for a long time. Big dogs are tricky for all this. One of the best ways you can immobilize is a sled. You know, those big plastic toboggan sleds, they are excellent for getting a dog and getting them to lay on their side is usually the best. If we can get them to lay on their side, a blanket or towel to just kind of hold them gently to get them to the vet. If you had to wrap, like if this was a chest, and again, I'm talking about a little gross stuff, sorry. If it was a chest, one of the most important things would be if you hear like a sucking air sound, then you might want to go grab the plastic wrap, saran wrap from the kitchen, take some Vaseline or ointment and put it around that object, and then wrap the plastic wrap and then hit the car, because that's when you could have that air sucking into the chest and collapse a lung and be life-threatening. Again, these are a couple things I hope none of you ever see or even know anyone that ever sees. But they're ones to mention. So let me go to the common, easier ones. Fish hooks. Has anyone ever had a dog or get a fish hook? Yeah. And it usually happens when we're fishing and the dog's running around and we don't realize that there's bait, then they're like, oh. And I came from the South and people notoriously use hot dogs on these fish hooks. Can't tell you how many fish hooks I had to take out of dogs' stomachs that were, at the lake for fishing, and lo and behold, they swallowed the piece and we had to go get it. But fish hooks have a barb on them, right? So if you have one and the dog is happily, I lost my little thing. Oh, here. Happily sitting there with it through their lip, or it's through their skin. And you're like, okay, I just need to remove this and then get my vet to tell me if the wound needs antibiotics or anything. The little clippers, remember what you want to do, this may be common sense, but you cut the barb off. You don't back it out first. Cut the barb if you can, then you can back it out, because that barb is just going to rip and tear and they are not going to let you do it. But fish hooks, I've definitely seen a few where I was like, oh, you could have cut that barb off and done this yourself. But again, that's when you have to stop, think, and if you can get someone else with you, it's helpful that you can come up with those. Similar to a fish hook are quills. So much fun. Why do our dogs do this? No idea. We actually had a dog that literally managed to swallow probably a baby porcupine and had the quills all through the stomach and everything. So sometimes they really are not very smart about this. Most dogs, they go sniffing, checking out this prickly kitty cat, and then they get the quills in the nose. So there are some bad advice out there. Yes, they are typically hollow, but cutting them does nothing. Do not cut them. That is a waste of your time. The only thing cutting them does is when they're banging into your leg, maybe they're not as sharp. But there's really no point in cutting them. It's not going to help anything. It's not going to release anything. Those, like the fish hooks, have a little teeny tiny barb on the end. So when they go in, they stay in. And when you pull out, it hurts more to pull it out than it did to go in. So that's why most dogs need to be sedated. If you have that wonderful dog, you have patience, your friend has patience, maybe you have tranquilizers at home because your dog needs them to go to the vet. And the quills are here, not in the mouth, where they could actually take some pills, and it's Sunday night and you don't want the emergency clinic, then you can use, like I said, I highly recommend making sure they can't bite. So back to if they're just I did this to my own dog once. She had 3 in her nose. She came running back to me looking petrified. I held her snout and I plucked 2, 3. We were done. That would be fine. You don't need to go to the vet. You're good. These are a great tool for your first aid kit. You can buy them at the flea markets. I think the Waterbury Flea Market has them. You can order online. These are called a hemostat. We use them when we're suturing, like that. They're excellent for removing fish hooks from fish mouths. That's what my dad uses them for. So excellent tool, but they sort of latch together. Most of us have needle nose pliers. Those are the same thing. Your whole goal is just to grip that quill, pull fast. Grip it close to the skin, pull fast. Most dogs are going to tolerate a couple, and then you got to give them a break. And I really feel like most of them, it gets a little inhumane to just keep going and going and going. So you know your dog. Most of the time you're going to want to let the vet do it with sedation. But if it's not possible, again, what if I was on the long trail and I got to hike 6 hours to get out of there? I'm going to probably try to get some of them out so my dog can be a little more comfortable. I will say they get used to them. I have had dogs come in that had the quills for 24 hours because the owner said, well, I wasn't going to the emergency clinic and he's going to have to learn his lesson. And the dog's just laying there. This is my plot in life. So they do sort of get used to them. Most panic and try to rub for a minute, but they do settle down. So the stop and breathe is okay. But just think about what you would want done to you. So bite wounds are another trauma that you'll see, right? A lot of times, not all our dogs are as friendly as they want to. Bite wounds from dog to dog are often much more trauma under the skin than you realize. So your first aid should really be just to not get injured, getting the dogs apart, assess your dog comfortably, look for puncture wounds, bite wounds, tearing, where the fur is wet is a good place to look. If there seems to be a lot of trauma, they really should see the vet. And within 24 hours, yeah. Because the infection starts sitting in, our dogs have a lot of dirt in their mouths and germs that are put into those wounds. The worst is when you have a little dog and a bigger dog attacks them. They really need assessment by a veterinarian, and your most is to be just scoop them up, keep them comfortable, and get them to the vet. Burns are rare, but I did want to mention burns. Usually a burn is going to be at the campfire, and we're cooking food or something like that, and they get too close and then their fur is singed. Just like us, the first thing is, if there's flames or smoke, blanket, towel, something to make sure that the fire, if their fur is on fire, stops. You can apply aloe. Most burns are pretty darn tender though, and if there is actually skin lesion, fur gone and the skin looks burned, have it assessed by a veterinarian. It's really difficult. I can barely tell what a first and second degree burn to myself is. So have that one checked out. Fractures, what do you think? Take it to the vet? There's very little you can do to stabilize a broken bone, except try to get the dog into a comfortable position so they're not having to put weight on it. If it's bad enough that the bone is actually poking through the skin, that goes back to our first aid of if you can just wrap a light something like a towel around it just to protect it, so that, and the more immediate they get medical attention, the better. Again, I hope you never see those. Let's go to some of the easy fun ones. Allergic reactions. And you see those a lot in the spring when the ground's starting to, my daughter always said when will the grass come back, when the snow melts? I just love that version. The grass comes back, not the snow leaves. And so you get all those little ground bugs and bees, and the dogs are sniffing and they're in there. Are you hearing me okay if I'm not by the microphone? Okay. And what happens is they get a little bee sting. They swell up and your beautiful pointy-nosed dog looks like a manatee or a Shar-Pei. And that is all, I can diagnose that over the phone. So I'm not going to give you a lot of give this drug at this dose, but the one I will tell you, because it's all over the internet and it's a very safe one, is Benadryl. Yes. So if you see that, like, weren't swollen 20 minutes ago, and now they are, and they are the dog that goes trying to catch the bees, or they were down by the ground, it's a bee sting or an insect bite, and they're getting that welt or that like hives. So Benadryl is very safe to give. And I will answer a question. The dose is on the internet, but it's basically 1 milligram per pound of their body weight that you can safely give. If you think your dog is really old, has heart disease, seizures, medical condition where you're scared to give Benadryl, you should be. Ask your vet first. But this is always in my dog first aid kit. When I tell people you're going on that hike or whatever, have Benadryl with you. Yeah. Question.
A few days ago I got injuries and I used Benadryl.
You needed it too. Did you start to get like achy, swollen?
Yeah, it's getting swollen and like that.
Yeah, and Benadryl works pretty fast. Yes, it does that. And if you're gonna do first aid kit, the caplets are better than the capsules because you can break them in half. They're 25s, so that's also pretty easy. I've got a 50-pound dog, they get 2. I got a 25-pound. I have a 10-pounder, I can get away with a half, right? All right. When in doubt, call your vet, but that one is a very safe to give and try to get the swelling to start going down. Once they have a lot of swelling, it's very rare that they're going to progress to not being able to breathe well, but you obviously watch breathing. If there's breathing effort, it's pretty rare that they're going to like swell their airway shut. Unless they are a squish-faced dog, which I love so much. Yes, the Frenchies, the pugs, those dogs may have more issues with their airway. So keep in mind, keep a really good watch on them. And to me, it's more of like you can give it, but call. Some common things we see in Vermont that are not a big deal are, have you ever seen those red, look like what we think of Lyme disease target lesions all over a dog's belly? Anyone know what they are? Black fly bites. Oh, and they bother us more than the dog is the great thing. Most dogs are not itchy, they don't bother them. The first time I moved to Vermont and I saw those, I thought the dog had a bleeding disorder. Like, what the heck? This is like petechial bruises. Anyway, so it wasn't, they're black fly bites. They usually go away, but if your dog's getting a lot of them, they do make safe insect repellent sprays and lotions that you can get at any of our local places or online that you can put on those. It's usually the naked areas, like the ears and the bellies. Ticks do not cause that lesion on dogs. So if you see it, it's probably a black fly bite and it's probably not a big deal. Ticks, obviously, if you find one, you can remove it and get some good tick repellent or preventative from your vet. Snake bites. Has anyone ever had their dog get a snake bite? No? So that means you haven't lived in the South. So I was very happy to move to Vermont and find out there's only one venomous snake, and it's a timber rattler, and it's only in these little teeny tiny places in the part of Vermont I don't go and I don't live. So I'm very happy. So most of our snake bites to our dogs are not a big deal. And when there's a snake bite, if there's any issue, it's more that there would be 2 little marks typically, sometimes 4, but 2. And snakes have the worst bacteria in their mouth. Snake bites always get really infected when they're venomous snakes. Our little garter snakes and stuff, usually it's more that our dogs are traumatizing them. So I don't think you have to worry about that. But if you, say, spend half the year in Arizona with your dog, you do need to make sure you know where a vet is that has anti-venom, and they give that, and that works really well. And they often need antibiotics because they can actually get, just like you hear about spider bites where the tissue gets necrotic and dies. That can happen. They can get badly infected. But fortunately, with snake bites, you don't need to deal with it. If you do see them, this one has it on there. You don't do any of those old-fashioned things of like cutting it or sucking the venom out. Never, never, never. You don't do a tourniquet to keep it in that one part of the leg. You're actually more likely that you're going to have dead tissue by keeping it there. So get to the vet. The Canine Collaborative folks brought me a few topics that I love, and one is, as I'm doing up here right now, overheating, heat stroke, that type of thing. And this is the time of year, right? It's lovely. We want to take yes, it's beautiful. We want to take our dog everywhere. But I don't know if the interior of your car is black like mine is. It was literally like 60, but my car was in the sun. I got in my car and it was easily 100 degrees. So I have a chart here, and it's in this article up here about hyperthermia and heat stroke. They basically, so we have a lot of those days where, right, it's 70, it's nice. I'll park in the shade. I'll leave the windows cracked. There was a study where they showed that, and I gotta make sure I quote this temperature right. It was a Stanford medical study. They found that inside a vehicle, the temperature will increase 40 degrees Fahrenheit within an hour, regardless of the outside temperature.
Oh.
So, okay, it's 30 outside and it gets up to 70 in the car. Your dog's probably fine. But your car is kind of a refrigerator too. It's not really keeping them that warm. So they really, if you can avoid leaving your dog in a car, avoid leaving them in a car. If they're in the car, the windows need to be really well open because a Good Samaritan's going to break the window and let them out anyway. So you may as well have them down enough and in the shade. And you need to, it's kind of like if I left my child in the car and ran into the grocery store because they were asleep and it was just going to be 10 minutes. I'm in there, I fall and I get struck unconscious. I'm taken off to the emergency room. Who knows my kid's out there in the car? It's the same with your dog. So there's a great video. Dr. Ernie Ward is a veterinarian, and he put himself, it's kind of crazy, he put himself in a car with a thermometer, and he had the video going, and he lives in like Texas or somewhere, and he was like describing how he felt, and within 15 minutes, his car temperature inside was at like 125 degrees, and he was starting to show heat exhaustion. So it's really just not safe. So what if your dog gets overheated anyway? I had a dog when I first moved here who stuck his head in a watering can. He must have been looking for water, and he got his head stuck. And he was that way for a couple hours. He was getting really overheated and panicked, right? Because he could not get his head out of there. So what you can do is cool them down. The things that you don't want to cool too quickly. Like we don't want to go into an ice bath. Obviously get the bucket off the head, or you're recognizing my dog is too hot. I can see their tongue is out. They're really, really stressed here. They cannot sweat like I can. The places they can sweat a little bit are like between their toes, and obviously panting is their big thing. If you can take a temperature, which is another thing that is in you should have in your first aid kit, is just a cheap digital thermometer. You know where to put it. That antibiotic ointment you have, a little bit of that on there would be fine. Just something that keeps the little silver tip. You just go in about a centimeter past that, half an inch for those who don't like the metric. And it's in there, it beeps, it tells you. If they're above we want them to be less than 103. So if they're less than 103, they're not too bad, you're doing fine. A lot of dogs, when they are truly going into heat stroke, they're going to be 105, and we want to cool them down. So just evaporative cooling. So a wet towel, you go running at your dog that's panicked with the hose, that's probably not best, but a cold wet towel that you can drape over them. Now, alcohol, right? Isopropyl alcohol that we use to clean things, that is you know how cool it feels when it evaporates on your skin? That in between their toes is a great thing. You can put it in the armpits. That's going to evaporate and help cool. But a cool cloth draped over their head, cooling on the ears. You don't want to get them so wet and then bring them into the air conditioning, because their temperature can then plummet down to less than 99, and then they're shivering, and then that can actually set them up for worse consequences from being overheated. So slow cooling over several minutes is the best way to go. I'm trying to think if there was anything else on that. I think that was it on that one.
How could you tell when they were out of heat exhaustion outside if you didn't happen to have a thermometer with you?
The biggest thing is they'll stop panting. And let me go back to, yes, so many of us, like me, don't have air conditioning, but I have fans. A fan is one of the best things. So a fan where you could just get them damp, or that wet towel on them and in front of a fan, just the fan blowing. It's just like in your car. If you at least have the fan on you, you're gonna cool down. But the panting to slow down, if you see, and pretty much if they were, like you did document temperature and they were 105 or hotter, start cooling and you really should consider getting them checked out by a veterinarian to make sure. Dogs can have fatal consequences after a true heat stroke, and veterinarians can save them, literally with like plasma transfusions. So we don't want them to get to that. Yeah, question on that.
And what if you're hiking and there's a trail creek and she jumps in, and is that actually too cold for them?
Usually not. Yeah, I'm amazed at how cold they will go in. If they'll go in there and they'll wade in, and that is great. You're not going to be at risk of them overheating if they've got shade and they can go in a cool stream. Yeah.
But it's not going to be too fast, cooling too fast.
Well, so say they got in there, and then, after maybe 5 minutes, get them on out, check them out. They're usually going to have stopped panting and be calming down. But if they got in there and then they kind of collapsed and couldn't get out of the cold water, yes, they could get too cold, because a lot of our streams are still too cold.
So are they cooling with their paws too? So if the water is cold?
Yes, that is a great way. Just standing in cold water is excellent. And if you have a dog, like I do, those squish-faced dogs, I brought these not to sell this company's stuff, but they actually make cooling neck wraps and vests for dogs. So I take I don't want to confess, Frenchie, to Maryland, Southern Maryland in the summer. And if they are overheated, what happens? Their airways swell, they can't breathe, and I don't live there and have my vet license there, so I don't want to have to treat an emergency with my Frenchie. So I will literally, these things, you just wet them, and they're evaporating. They evaporate quickly, so you can put them on them, and it's evaporated cooling and keeping them cool when they're running around on the beach and stuff, and there's a neck one too.
I have 2 cool mats.
Yeah.
And I have one in the living room by her bed, and I put one at the end of my bed.
Yes.
And if she's too hot, she'll go lay on there. And they have gel in them that absorbs the dog's heat. But if the dog lays on it for too long, it actually becomes hot.
It can warm.
Right, because
Yeah.
it's absorbed all the heat, and then you have to let it expel the heat. But she decides when she wants to lay on it.
So dogs are very smart. There's almost no dog that will ever starve itself. They will eat eventually. They just make us think that they won't until we give them the tuna fish or something. Same with thermoregulation. If they're a healthy dog and they can move around, you might find that they're seeking out the cold floor until they've cooled off, and then they'll move around, yes. They're not going to stay where they're too hot or too cold for the most part, unless they're incapacitated, yeah.
Will a cooling vest like that work for a dog with, say, like a double coat?
It can, yeah, it can. With them, though, it's pretty much the ears, armpits, belly, paws, and if they go swimming, it takes a while for their coat's going to evaporate for a while. Yeah, the fan is really the best. Yeah. All right, so I did want to show you a cool video because I learned something. You can always learn something. Everyone always can. And choking. Choking was one of the ones that came up. So I will tell you, more times than not, you think your dog is choking and they're not. They're actually coughing. So when if they're doing an expiratory, I'm a terrible actress, sorry, gagging, doing that type of thing, that is forcing air out. Choking means you cannot suck air in, right? That's when you've learned to do the Heimlich maneuver. So if you have your dog, the classic one is maybe playing with a ball, or they're a dog that plays with, like, I don't know, pecans, chestnuts, walnuts, something like that, and they're throwing it in the air and it goes down and it gets lodged right here. So that dog is usually going to be passing out. They're panicking and they're going to they could go unconscious. So I want to give you something you may possibly see, usually around a ball, because this video is a really cool trick. So I'm talking about a dog who's unconscious. Like, they were playing ball, they passed out. You can literally feel the ball in their neck, and that's what this cool video is going to show you. So, it's this one. So, and again, it's right on the list. Let's see if I can make it big. Woo, cool. All right. So this is a dummy dog. This is like a mannequin, like when you do CPR on a mannequin dog. And what the person demonstrating it is, she's going to show how you can feel the ball right here. So if our dog is passed out, the first thing you do is check for airflow, right? There's no airflow. You can feel the ball there. What she's going to show is you need to extend their neck, right? Not like this. They need their neck extended for something to come out. But I watched this like 5 times. I found this fascinating. Oh, is the sound not up? So she's showing that you can literally feel the ball there. She's touching it. And then she's getting her thumbs. And with the thumbs, you do what's called a J stroke. So see how her thumbs with her first finger make sort of a J shape? You're going boom. You're pressing forward. And watch this. This is so cool. None of us will ever get to do this. There's the ball. Isn't that amazing? I was like, wow. So I know if I have a dog come in to me and the owner's like, I think he's choked on a ball, I know what I'm going to try. But that is, again, if they are unconscious. Most of the time, what you're going to see is they're gagging, they've got an irritated throat or a cough, it's expiration. But if they're truly having a hard time sucking in and they're still conscious, there's not going to be a lot you can do, except if they're very cooperative, you can try to sweep, this is that, watch the fingers, the back of the throat. So I'm going to show our happy husky here, because his mouth is perfect here. When we want to get in that mouth to do that, the best thing to do is to press their lips. I just spit everywhere. Press their lips in, because a dog can't bite on her own lips. So if you're pressing their lips in, your fingers are a little protected for you to get a quick sweep at the back of the throat and go back there. And you're just doing a sweep for if there's something you feel there. Once, and I'm going to warn you right now, and these notes say it too, dogs do have basically the equivalent of like their Adam's apple, what's called the hyoid apparatus. So I'll be back in there with an unconscious dog feeling around for a stick or something, and there's this cartilage there. So if you feel like you're snagging something, don't pull. That's probably their cartilage. Literally, you're looking for something that's like a wad of fur or a ball or something that's gotten stuck in there that you're going to pull away and let them have airway again. One that you will see that I'm going to hope to save you a vet visit for, stick across the roof of the mouth. Anybody ever had that? Yeah. The dog is usually like this, and they're pawing at their mouth, and they were just chewing on a stick. They bit down just right. The stick broke perfectly, and it's lodged right up between their molars across the roof of their mouth. So back to Happy here. It is literally like right across the roof of the mouth. And so if you can get the lips in, and without your finger, you can take, I have my hemostat there. You could use a screwdriver. You could use the handle of a fork, not the pointy end, the handle, something that you can go pop and just pop that sucker out. You'll save yourself a vet visit. There are dogs that are so panicked that we just have to sedate. But if they are doing that, try to get a good look at the roof of their mouth, because the unfortunate thing is if it stays there, if we didn't notice, the dog, we missed that window and the dog just got used to it, it gets pretty nasty. I've taken them out when they've been in there 1 to 2 months later. And the dog, there's infection, the roof of the mouth, and they lose teeth because it's putting pressure on those molars. So you can get that stick out or come to us. We'll get them out. Yeah?
My dog had one stuck the other way, straight up and down.
So that's more of like,
That's a lot harder to get.
couldn't close the mouth?
I've never seen his mouth open that wide. I didn't think it was possible.
Yeah, could you pull it like a tent pole?
I had to, yeah.
Yeah. That one, my hope is that would be a pole that you made it bend. If it's a thick enough one, I would be wanting to try to loppers or pruners, something to cut it so that it could, right? Yeah, and then we want to make sure it didn't impale the roof of the mouth. But
That was my concern, that it was going to rip the roof of this.
yeah, it would after. I mean, at a certain point, the dog would probably have it go one way or the other, and that would be bad. So that's a stop, breathe, but a quick reaction of pull some way. Oh.
I didn't think the dog's mouth could open that far.
Yeah. How did it? Oh.
I don't know how he did it. I just heard a weird noise. I said, that's not normal. And I looked out the window and I said, oh.
What would you do for a dog that got their snout caught in like a bone, like one of those big like cow bones?
Like the whole nose? Okay.
It's like the bottom jaw.
Yeah, usually it's the bottom jaw. Those are tough. I have had to remove them a lot at the emergency clinic. A lot of times it's like a shorter like ham bone section and they're chewing on it and then all of a sudden it slips just right and gets lodged right behind those canines, and they're sitting there like this, and then their chin swells up. That's the hard part. So if you have a really cooperative dog and you can get something like butter, cooking oil, something slimy to help it slide this way, slide forward, then you can take it off. Most of the time, though, they're not going to let that happen, and sedation, and we've had to like do a bone saw to cut the bone. Yeah, especially if they get swollen enough. It's sometimes we can't get them off without, you know, cutting it. Don't give, yeah. So it's a round bone not the bone that's on the dog, not the dog. But yeah, so the best is not to let them have bones that are shorter than like probably 4 inches. Like 2 inches are usually those pieces that happens to. I want to hit a couple. We're in first aid. We've got 15 minutes until we're going to stop talking. I want to give you a little short list of the stuff to have with you in your first aid kit that I haven't hit. So I said thermometer, always good to have. If you can get a hemostat or put the needle nose pliers in there in case you encounter porcupine. Something that can bandage, an ACE bandage is great. The Telfa pad and maybe a roll that you can buy of the like Coflex kind of stuff, because that's an easy, quick one. A maxi pad in there, that with this stuff on it is a good temporary bandage. The other things I tell people, that these are generic like All Dog. They sell eye wash, and you have it for flushing our eyes out. A bottle of that is a great thing to have, because just like when you have to spray your eye out because you got something in it that hurts, you can typically do that with your dog pretty well. It feels good, it's cool, it's rinsing. If your dog is suddenly squinting like something just got in their eye, or you thought that is something where you can rinse it out. Say you're by the campfire and like ashes, you could definitely flush a little bit and then make sure your dog, if they continue to squint, they need to get it checked out because that cornea could be injured. But the other thing is this eye flush is saline. So back to like a very basic little wound, you need to just kind of give it a little spritz. This is a great thing to keep a wound moist and to rinse it out. So I think that's a great thing to have in your pet first aid. Another couple, they're never going to do any harm, are things like Neosporin or bacitracin cream or ointment. Again, back to I have a wound, I want it to not get dry, I want to just put something on it till I can get to the vet. It will not hurt them to lick it off. So one of those type is fine. And hydrocortisone cream is the same kind of thing. You pretty much can't hurt anything putting that on it. Back to our carpenter ants or a bee sting, you've given your Benadryl. You're going to watch to see if the swelling goes down, call your vet, see if they want to see your pet or if they want you to watch and see. Back to the bee sting. I'm so sorry, I forgot this. If you can actually see a stinger and you can use tweezers to pull it out or squeeze it like a pop in a zit and get the little stinger out, that is helpful because it will quiet down and it'll get comfortable way faster. I confess that when my dogs had that happen, I never found the stinger. But if you do see it, yeah.
Our dog, she ripped her toenail off because she stuck it in the floorboards
And that happened. Oh.
And then we had to take her to the vet and like, what would you do? Like, would you wrap it with the...
Yeah, so that is a very common injury, and I'm very glad you brought it up because I left it off my list. Dogs in Vermont tear toenails all the time. The worst is typically when you get that crust on the snow, their nail's just long enough that it just catches and it lifts. So if it's torn off and there's blood, we go back to our be calm. Maybe you could even just slide a sock on there. Just to sort of be absorbent, right? Slide a sock on there. Blood stop powder that they sell at the pet stores for if you cut a toenail too short. Tends to have a little numbing in it and it helps stop it a little bit, so you can pour a little of that on it and then put the sock on. Yeah. The worst are the ones where it's lifted and it's still on there and it's really bugging the dog because they're often still like lodged in the nail bed, and it's most humane to have them sedated to get that off, and then it'll grow back in better, and then we can also either treat it if it's getting infected or prevent it from getting infected, and usually send you home with pain reliever. So the hydrocortisone cream could be applied to one of those itchy welt kind of lesions for no harm. So those are my basics. They're not a lot of fun, amazing things, but they are good things to have in your first aid kit. Another one that I wanted to mention goes to, because one of my vets, when I said toxicity, she's like, oh, I'll do a talk on that. If you know Hannah Flynn, she loves that. So I just want to mention a couple of the most common things to avoid letting your pets get into, and those are any of your prescription medications. Keep them out of your dog's way, keep them up high. If your dog is on any medication that is flavored, keep it up where they cannot get it. A lot of our pain relievers nowadays, I love sending home chewable medication because it's way easier for an owner to give it. But if the dog eats the whole bottle, we got an emergency bill. So keep those out of there. And another weird one that I'm going to look over here. Do you guys ever get to have sugarless gum? Sugarless chewing gum? Yeah. Sugarless chewing gum. The best sugarless chewing gum has a sweetener in it called xylitol. And why xylitol is so good, if you read the dental articles in human medicine, is it actually helps fight tooth decay. Because xylitol helps, I can't remember, it's something about the pH in your mouth or the bacteria in your mouth or the enamel of your teeth, but it actually helps your teeth. So xylitol is a good sweetener in chewing gum for people. Dogs also like to eat it. So if we have sugarless chewing gum, we need to keep it up where our dog can't eat it, because if a dog eats enough xylitol, they can go hypoglycemic. So their blood sugar drop.
You have to be careful about peanut butter because some of that.
Yes, there are some sugar-free peanut butters that have xylitol. So very few of us have it like to cook with or anything. That's the worst. But yeah, xylitol is a weird one, but it's often, and I'm going to blame the teenagers older than you. Teenage kid, big old cup of sugarless gum in their room on the nightside stand, and the dog gets into it. You wake up, you go to the dog's passed out in a coma because it's got low blood sugar, and it can affect their liver. So those are ones I want to just really keep away from them. Another first aid Vermont one that I want to mention, and then we're going to do good on time, I think, is HABs, harmful algal blooms. We've heard of blue-green algae, right? So this is and I'm thinking about a lot of us being outdoorsy with our dogs and going around the pond or a lake or on the trails. Always look and watch what the water looks like. If that water has foam or scum on it or is discolored, do not let them drink it. And it's actually not even ideal for them to swim in it. Because they can lick it off themselves. And most dogs, when they swim, they're drinking a little water too. They're dangerous to us, but they're very dangerous to our dogs. And they can actually die. They can get sick enough from them. Symptoms that they would show is often like getting really lethargic, vomiting. They can have diarrhea. They can start to get like jaundice color to their whites of their eyes or gums. This is like they ingested it and it's a day or two later. Difficulty breathing, excessive drooling. So really, they're pretty good at putting up signs. I know like at Lake Champlain, there's been a few times where there's been signs up, do not let your dogs, do not swim here because they're having blue-green algae. So, and that's a misnomer. It's actually not an algae, it's a cyanobacteria. But these harmful algal blooms happen more and more in parts of our country, mostly because like fertilizer runoff and things like that. So it's a real thing. And, I got a fun toxicity. Oh, go back, yeah.
I was just gonna say, if you wouldn't swim in it, don't let your dog swim in it.
Right,
Kind of like,
exactly, yes, yeah. And a lot of times if we go to a place like a reservoir or a stream or a river and they don't want to swim in because E. coli, too much septic, or we with flooding, right? We had a lot of sewage, or our septics contaminate the rivers and stuff. Well, the dogs can get pretty sick from that too. Rarely would they get sick enough to die unless they're really like don't have a good immune system. But yeah, they could get some pretty bloody diarrhea and really sick from it. Some fun things, I should end on a fun thing, right? Some fun things that look like a toxin but aren't are when your dog loves frogs, toads, right? Or bug catching, right? All of a sudden, they're just, you think it's, like, do they have rabies? They've got foam and saliva just pouring out of their mouth. Cats are good at this too. And they'll just be foaming and drooling. They tasted something awful. That toad secreted one of its chemicals, its survival instincts, and it's just like, it's the most bitter, god-awful tasting thing that they're just like, Cats do that often if they like catch a moth in the house. The same thing will happen. So to make them more comfortable, if you can get them to eat an ice cube, or you can get a washcloth really saturated and kind of wipe their tongue or let them chew on it for a sec, that'll help get it off their tongue and make them feel better. But you don't have to rush them to the veterinarian for those. They are, yeah, and they won't learn. They'll do it again. They'll do it again, just like the quills. So I think we're doing okay enough that, back to your first aid kit. If your pet has been prescribed, your dog is on an anti-inflammatory, or you have some left over from their spay or neuter surgery, then you have something that is appropriately dosed for your dog, and you can contact a veterinarian, or you can say, I have this, is it safe to give? Or you can at least feel comfortable that it was safe to give. If your pet is been prescribed anti-diarrhea medicine before, same thing. If you've got a really bad case of the diarrhea, you're worried they're getting dehydrated. And the same thing with vomiting medicine. So if you have those, you've had prescribed and you've used them for your pet, put them in your first aid kit. Take them when you travel. Have them with you. And it's much easier to I've had clients call me, they're out of state. And I brought that with me. And I can give the advice over the phone. Veterinarians are notoriously, just like human medicine, no one wants to give you advice over the phone, and what you're telling seems accurate, but we get the diagnosis wrong, and we never want to cause more harm. So they're very cautious about giving a dose of something over the phone when they haven't truly confirmed what's going on with the pet. But if it's something your pet's already been prescribed, and you can say, well, he's had this before, this is the dose, would this be safe to give? They're going to feel much more comfortable, even like the emergency clinic, saying, yes, that would be safe for your dog. I am worried about this, and they'll caution statements. But back to when I was mentioning the poisonings, I'm going to pull this because this is a great one for you to put in your notes. There is right there, if you can see, the ASPCA Animal Poison Control Center and the Pet Poison Helpline. Those are great. It varies. Sometimes there's a fee, sometimes it's free. You could always also call the Vermont Human Poison Control, if it's especially like a medication of yours. But those have great resources, and you can get a lot of information fast about, do I need to worry about this or not?
We have a card out on the table.
With that one. Good. So we have time for questions.
I just like to make one statement. When Bruce and I got Coco, I had no idea where Bev's was.
Yes.
And so, because all I heard was Williston, and we took a ride quietly, and just the two of us went to find Bev's and had to get there, and darned if 4 weeks later, Coco got into chocolate.
Uh-huh.
And we had to make a mad dash to Bev's, and I said to him, thank God we knew where it was, because I'd be freaking out if we're looking for it, while the dog's potentially getting really sick. So if people don't know where it is, I'd suggest you go scout it out.
Exactly. Know where, and if you're traveling, that's another thing too, is like, I've taken my pet with me. Where am I going to go if I have an emergency? Yeah, so Burlington Emergency Veterinary and Specialty Center is in Williston. That's the one that we're talking about. Right. Yeah. All right, let's go back here first.
How do you keep a bandage on a dog or a cat when it's just not taking it off?
Yes. Are you talking about a bandage that like is supposed to stay on for a day or two, like that your vet put on it, or one that you just need temporary?
You gotta keep. Well, you put it on. You're going to keep it on, but the dog, there you go.
So what I like to use is bitter apple spray or bitter yuck. They make those things, again, things you can buy at the pet store, that you can spritz on that bandage, and then it'll at least taste bad, and they'll usually leave it alone. If possible, because you kept it in the garage and you have the cone of shame left over from something else, getting that on, they will usually leave it alone. You can also throw a tube sock over it, do a little tape at the top, because at least then they've got the sock over it. Yeah. And then distraction is another great thing. So it's like, I've bandaged this. I need to keep you to leave this alone until I can get this taken care of. Distraction, whether you've got like a chew toy they love, or a bone they can chew on, or a rawhide, cheese, little bits, feeding them lots of little tiny pieces of food to distract. Yeah.
The reason I was asking that, because we had dogs that I tried to keep a bandage on so he wouldn't get
Yes.
And, so, you know, he could be anywhere, but he would try to take it off.
Try to take it off. Yeah. If there's a chronic like thing where, you know, we're dragging and we need to protect it, things like booties or something that they'll learn to tolerate is, yeah, sometimes better. And then, yes.
Sir, if you're not near a vet, and your dog comes down with a boat, which I had on a camping trip, is there anything that you can do?
That had what happen?
Is it for the Malamutant, broad-chested dog?
Yeah, bloat.
Bloat.
Oh, absolute nightmare. Yes, and I'm so sorry. Yes, so bloat is a condition. Usually it is our large breed, deep-chested dogs, and for no good reason, they can have their stomach start to fill with air, and it can twist. And then when it twists, so, you know, we stand like this, right? And so our esophagus comes down to our stomach, and then it leaves from the small intestine, esophagus one side, stomach the other. If I'm the dog, though, if I go over to Happy here, my Happy Husky, that stomach is in here, and if it fills with air and floats a little, it can twist, and then the tube coming into the stomach, the esophagus is closed off, and the tube leaving the small intestine is closed off. And then that gas begins to keep going and going and going, and if it goes on too long, they'll die. Unfortunately, I can't think of anything that you could do. You know, when is getting to a vet as soon as possible, recognizing that that's what's going on, because it's literally like MASH medicine. I want to say, you know, like I love that show, MASH, right? Wartime medicine, where, you know, like where someone in an emergency situation has to put a hole in a trachea to save someone's breathing, right? It's almost like that, like in an emergency situation, like when people pop a balloon with a needle, like we will, on a really urgent case, scrub up the fur and pop a needle through the skin into the stomach to let some of that gas off. But it would be so hard to teach people where to go to not hit the spleen or something like that and cause more harm. I will say, if they can vomit, then they're not, like if stuff is actually coming up, then they're not twisted yet.
Trying to vomit.
Right, it's dry heaves. Non-productive vomiting is you want to go as fast as you can. We literally sedate them and we pass a tube through that, twist it off to get into the stomach to let the air and fluid off and get it decompressed as fast as possible. It's the worst case scenario.
It didn't end well.
No, and I mean, that is one reason where people who love these breed and size of dogs, it is worth a discussion. The biggest, you can Google, you can go on this Vet Partner, the breeds that are most prone to bloat or GDV, gastric dilatation volvulus. But, and we many times when we spay, we'll do a prophylactic gastropexy. I have clients who've had Great Danes forever. Every single time, even if we're doing a neuter, we will go in and we will sew the stomach to the body wall. So they may be able to bloat, but they cannot twist. So they will not die, and they'll be able to be treated medically. So prophylactic doing that surgery is absolutely worth it in those highest risk breeds. So, Sin had some question.
I'm wondering about compost.
Oh, compost, so fun, yes. Do not let them get into the compost. So yes, we're all composting as we are supposed to do and required to do, and that's great. Definitely do whatever kind of fencing you can to keep your dog out of there, because as any of that organic matter starts to rot and decompose, you often get aflatoxins is what they're called. It's the same thing that happens with like hay silage or rotting hay, those kind of things. As that matter breaks down, when they eat it, they get those aflatoxins. They can the worst case is they get enough that it's actually toxic to their liver. Most of the time, it's a lot of bad GI upset with vomiting and diarrhea that usually needs some supportive care. But if we can keep them out of it, and I want to mention one weird thing about compost that goes into those weird toxicities, but a lot of people like to do things like homebrew beer. So have you heard of hops? I love a good hoppy beer, right? IPA is my favorite. So hops, when we do the hops, if you homebrew, people who don't homebrew, let me tell you, you put it in a little sack, and it's called the wort, and you put it in there for a while, and you take it out, and it's a great thing, those hops, very potent hops, to throw in your compost pile. Highly, highly toxic to dogs is hops, and they will get malignant hyperthermia. It is heat stroke that you cannot stop. they will start convulsing and shivering, and they can die from it. So hops toxicity is extremely severe. So if you homebrew or grow hops and you put them in your compost, definitely make sure the dogs cannot get into it. So that's a weird one, but I've seen it, unfortunately. Yeah, but someone will be like, oh, my cousin homebrews, I'm going to make sure he doesn't do that, right? So back there, and then I'll come up to you.
I actually have 2 questions.
Sure.
Is it true that dogs can get bloat if you take them for a walk after they eat? And how long should you wait afterwards if they do?
So much like the whole thing about if we swim after we just ate, that we'll get a cramp, so something will happen. They've done a lot of looking into what causes it. That's why they sell those feeders that are elevated for dogs. Fun fact, they did a huge study on large breed dogs that are prone to bloat, owners who fed with the elevated feeder and owners who didn't. They had more bloat in the dogs who were fed from the elevated feeder. But their theory was that it wasn't that it helped them from swallowing as much air, but the owners who bought those feeders knew about bloat, watched for it, recognized it, and they got to the vet and got the diagnosis versus the ones who didn't. So in an ideal world, though, if our dogs just ate a meal, a normal size meal, they should probably go out, go to the bathroom, but they should not do a really big run or hike for about half an hour. Just let them digest a little bit. A walk is fine, right? What is a big problem, though, is probably if they accidentally got into the dog food bin, ate way more than they should. Those dogs really need to take it easy and not be over. So you're probably not going to cause it, but it's probably a good idea to just let them digest before we do the big activity. Back to the heat stroke thing. This time of year, it's best to do the exercise before 10 a.m. or after 6 p.m. as well. I see someone running at noon on an 80-degree day. I'm like, why are you trying to do that to yourself? Anyway, so exercise at the cool times. Another one? Did you have a second question?
Oh, those were my questions.
Oh, okay, good. Yeah, they're good. All right, right here.
So my dog eats grass and then vomits. Like, is that something we should be concerned about?
Not necessarily. So it's funny. I have seen dogs that just like to eat grass and actually don't vomit. They like the taste. It's sweet at certain times of day. Yeah, and yes. And then, but some dogs do it and then they puke and then they're fine and they run around and they're happy. When it's probably a problem is if they're doing it and vomiting and then doing it and vomiting. Like maybe they're sick and they're trying to tell us that they feel off and we need to get them checked out. But yeah, I ate some grass and I vomited some saliva and grass is probably not a big deal. Yeah.
What happens if your dog pokes its eye with a stick or it starts bleeding?
Yeah. So one of these things on here, is it okay to show a gross picture? Sure. Okay. One of these topics on here is eye injuries. So I'm glad you asked that. So don't look if you don't want to. So the eye flush is good. Got poked with a stick. Usually it's not stuck in their eye. I've never seen that. But that's the gross picture, and I'm going to just leave it there for a second because what this is usually, it's a common eye injury. You need to see the vet. You're almost not going to be able to do anything with that. That is a dog that, I'm going to gross like that. Some are bug-eyed dogs, right? Our dogs who have the more eyes that bug out. Well, bug-eyed dogs. So what's interesting about our eyes is you have bone, right? We have a skull and we have bone almost all the way around on us. Dogs don't. They have bone around about 2/3 and then they just have a ligament. So it's easier for their eye to pop out of the socket, which is what that picture was. What happened to that dog was his eye got popped forward and his eyelids are behind it. So if you are calm, cool, collected people, and that happens to your dog, and you have contact solution or some eye stuff, and you want to split it on the eye, and you want to try to just pull the eyelids and push the eye back. I know, I lost you all, sorry. We're just going to have to cut this off. Then you can, most of the time, that just needs the vet.
we want to thank Dr. Radley for coming.
I don't think I ended well.